Metatarsalgia happens when you have any disruption or alteration to the stabilization mechanism of your metatarsophalangeal joints. So we tend to use met domes or any variation of a met dome to restore the transverse arch. In the acute setting, we tend to use a lot of this orthopedic felt hair, which you can get from Whiteley All Care. It's great. You can make all sorts of met domes and things to offload your first ray. So you can cut out and create your own met dome. Okay, so what we're trying to do is basically offload the plantar pressure of the second and third metatarsal joints, or whatever combination you find. So we tend to use a met dome for it, and studies have shown that the best place to put it is about 5 millimeters away from the metatarsal head. Now, sometimes it can be quite subjective. Some people like it close to the met head, others like it further away. But what we're trying to do is we're trying to redistribute force away from that met head. And what we're looking for is an instant change in their symptoms. If we want to offload this second metatarsal head of Carla's hair, what I want to try and do is I'm actually going to stick this met dome onto the foot. So I want to come about sort of 5 millimeters away from the metatarsal head, and I'm going to apply it there. So I'm after that sort of offloading of the metatarsophalangeal joint. Now, what we want to do to test this is we want Carla to stand up, and what we're after is an instant change in pain. If it's not an instant change of pain, we may need to move it a couple of millimeters down or a couple of millimeters up. The key point is don't put it on the metatarsal head or don't put it on the joint. If you put the met dome right there on something that's bruised and sensitive, it'll come back a lot more swollen, and you're not going to be very popular.